We're here doing a knee scope on a gentleman with catching and locking on the inner side of his left knee. This is the patient's left knee right here. I just made a couple of incisions. We call these portal incisions. So the portals allow us to go into the joint with a scope. Pop it into the joint, straighten the knee out. Push it into the joint, make sure we're in. Hammer inside. Or the arthroscope that has a light source and a water source, and then we look at the screen. There's the screen. We're in the joint. The joint is being filled with water so that now I have room. So now I can actually explore the joint. Patella chondromalacia. Chondromalacia basically means that the cartilage is irregular and rough. Look over medial. This is where the patient has pain. The patient's pain is here. So watch what I do. I'm going to go like this. Look at over there. We are in the medial side of the joint. So if you look back down at the knee again for me, I take my knife, open this portal up a little bit more. I don't aim down because I might hit the meniscus. I aim up. Open the portal slightly. A probe inside the portal. And then we look over there, okay? Medial meniscus is the one that tears more often. And the top of the meniscus, the bottom of the meniscus. I looked at the MRI earlier. I was suspicious for a displaced tear. So there's something underneath the meniscus. I use my probe to explore and to pull and prod. And I just double check, and I think we're gonna find something here. Yes, we are. This is why this gentleman has so much pain. Voila, look at that. Look at that big piece of meniscus that was hiding in that crevice right there. Very, very painful looking meniscus, and it indeed was painful. So all I'm gonna do here is trim this meniscus tear. That's called a partial medial meniscectomy. I'll smooth this cartilage out a little bit. But this is what was causing the patient's pain. That is a pretty ugly looking meniscus tear, and it was hidden right here in what's called the coronary recess. I hope you guys enjoyed that tour of the knee. Thank you.